Hi, I'm Dr. James Machino, and I want to explain the research and science behind the supplement from Adeeva called Nyquinadol. It's a supplement that provides natural relief for night pain and night pain-associated insomnia. Now, why is this important? Because many people have pain that keeps them awake at night or disturbs their sleep. And the drugs that are commonly used to control pain, if they're taken too often, can often lead to addiction and dependency. So if you're taking narcotic drugs or benzodiazepine drugs, there's a risk of addiction and physical dependency. Or other drugs can damage the liver. In fact, 50% of all liver failure is due to chronic intake of certain drugs that block pain. The same is true for damaging kidneys. There's a condition now called analgesic nephropathy, where kidneys become damaged from using painkillers and anti-inflammatories too often, leading to dialysis later in life. And also, if you're using certain non-steroidal anti-inflammatory drugs, you know they can cause stomach ache and ulceration and internal bleeding and some other problems. So doctors have been told to find other ways to help patients rely less on those drugs that cause addiction and drugs that cause liver damage and kidney damage and internal bleeding, and certain non-steroidal anti-inflammatory drugs even increase the risk of congestive heart failure and high blood pressure and sudden death from cardiovascular disease due to blood clots. So you want to try to rely less on those drugs if you can. So the natural solution is actually found in an herb called the California poppy. In the California poppy, there are these active constituents called the isoquinoline alkaloids. Once they're in the body, they bind to opioid receptors in the brain and central nervous system, and they block pain. But they also activate serotonin receptors, which helps to induce sleep. So the net result is taking a supplement like this blocks night pain and allows you to sleep through the night pain-free. And best of all, when you take Nyquinadol, which contains the right dosage and standardized grade of the California poppy, you don't feel stoned. There's no euphoria as you would get with certain narcotic drugs. So you don't feel stoned. There's no euphoria. You don't walk around in a zombie-like state. You're not in a trance. And there's no potential for addiction or physical dependency. You wake up in the morning, you're refreshed, you're able to function. There's no risk of liver damage or kidney damage, internal bleeding, no increased risk of heart attack risk or heart disease. So the bottom line is that Nyquinadol really helps you sleep better without pain, and it's safe to take. Now, when you sleep better, other really good things happen. Your body starts to heal faster. You have better compliance with treatment recommendations that you've been given. You have less fatigue through the day. You're not as irritable. There's less despondency. There's less of a risk you're going to develop depression from chronically losing sleep due to pain. And there's less chance you're going to become addicted to narcotic medications. So how big a problem is this for society? Well, in the United States, studies show that 110 million Americans suffer from chronic pain. In Canada, 25 to 40% of people over the age of 60 report chronic pain. And then throughout the year, many people have flare-ups of pain from car accidents or falls, sprains, strain problems, or they have an acute flare-up of a low back problem or a disc herniation, or they have a sports injury. And the thing about pain is that pain is usually worse at night because of the way the body's circadian rhythms work. And it keeps people awake, or it wakes them up through the night. Now, studies prove that the California poppy, when taken at the right dose and standardized grade, solves the problem without any addiction or major side effects. But you need the right dosage and the right standardized grade. You can't just grind up a bunch of California poppy and stick it in a capsule or a pill, as some companies have done. In Adeeva Nyquinadol, I've used the exact dosage and the exact standardized grade that's proven to give you effective pain relief based on the research. And for that reason, Health Canada has issued Nyquinadol a highly coveted NPN number, a natural health product number, based on the efficacy of the dosage and the standardized grade, as well as the safety and the quality assurance of the product. Now, Nyquinadol is also available in the United States and other countries. Now, how do you take it? Well, you take one, if you're in pain, you take one capsule 1 hour before you go to bed at night. It'll help to block the pain and help you sleep through the night. If it's not strong enough, then the next night you try 2 capsules 1 hour before you go to bed at night, but don't exceed 2 capsules. Now remember, You can't combine Nyquinadol with a nighttime dose of any narcotic drug or narcotic-containing drug or any other sleeping pills or sleeping aids or anti-anxiety drugs. Now, if a person already has a dependency on a narcotic drug, they have to work with their medical doctor to slowly wean them off of that drug while slowly introducing Nyquinadol. So that requires medical supervision. But, you know, most people wouldn't take Nyquinadol to block pain through the day. So it's really great for night pain, but through the day, there's other concerns, and that is because Nyquinadol has some sedative properties, you know, you're going to feel a little sleepy when you take it. That's why it's great for night pain. But if you need to drive or you have to be alert or operate heavy equipment, you wouldn't want to take Nyquinadol through the day. But pain through the day is usually not as bad as pain that people have through the night if they have chronic or acute pain. And through the day, to be quite honest with you, to decrease inflammatory pain, using Adeeva's Nature's Relief, anywhere from 1 to 3 capsules 2 to 3 times a day, is often very good at suppressing inflammation and pain through the day. But for nighttime pain, Nyquinadol is the perfect natural solution with a proven safety record, and it's highly effective. So the really good news is that it usually works the very first night that you take it. So you'll see an effect usually right away. So if you have acute or chronic pain, I suggest you try Nyquinadol 1 hour before bedtime, unless you're taking certain drugs or you have other health issues that would prohibit its use. So I hope you found this video to be informative, and I thank you so much.